The clinical features of Barrett's esophagus, clinically it is not detectable. Patients don't have any specific symptoms concerning Barrett's esophagus. They have mainly GERD symptoms only. So all patients of GERD has to be screened for the Barrett's esophagus. And then especially the patient is having a long-standing GERD, or patient is a heavy person, or patient is not responding to PPIs, definitely we have to look very closely into the GE junction. Now, what are the places where we have to look? It is 1 centimeter above the GE junction, and we have to look for the prolonged tongue-like margins of the mucosa coming into the esophagus. More than 4 centimeters is very important, but less than 4 centimeters also we have to be very careful. And how to detect this in a more early stage? We have different modalities. A routine endoscopic screening is important, and then we have other endoscopic techniques like NBI, there's narrowband imaging, or then we have this FICE, that is a flexible image intensifying color enhancement. Then we have other modalities like eye scan also. These are other modalities by which we can detect Barrett's esophagus in an early stage. And biopsy is very important to make a diagnosis. There are different stages of Barrett's esophagus. That is, patients having Barrett's esophagus without any dysplasia. The second is the patient is having low-grade dysplasia. Next comes the high-grade dysplasia, and the other one is the ICM, that's the intracellular malignancy, and the last one is the overt adenocarcinoma. So these are the 5 stages. Depending on the type of biopsy findings, the treatment will vary. And screening is also very important, especially the patient is having a low-grade dysplasia. The higher the dysplasia is more cancerous.